Obesity. Obesity refers to excessive body fat. It is a disease that affects nearly one-third of the adult American population. Obesity has been on the rise among Americans since 1960, and the trend has not slowed down. Today, approximately 68% of adult Americans are categorized as being overweight or obese. Each year, obesity causes at least 300,000 excess deaths in the U.S. Healthcare costs of American adults with obesity amount to approximately $100 billion and rising. Body fat is needed for energy, heat insulation, shock absorption, and other functions. However, too much body fat increases the risk for certain chronic diseases. Historical view of obesity. Overweight and obesity have historically been considered a measure of wealth and beauty. This suggested that these individuals had more than enough to eat. Excess fat in women was a symbol of fertility, while excess fat in men suggested wealth and the ability to provide for a family. Large bodies have been immortalized in paintings by artists such as Rubens and Renoir. In the late 1970s and early 1980s, researchers began to systematically use body weight as a measure of health. The 1976-1980 National Health and Nutrition Examination Survey, also called NHANES, showed a 15% prevalence of obesity among adults 20 to 74-year-old. Obesity is now considered by some to be the #1 public health problem in the country. Today, it is used as a measure of poor health and a risk factor for chronic diseases such as diabetes and hypertension. To understand obesity, we will take a look at fat cell development. The number and size of fat cells in the body help determine how easily a person gains or loses weight. Individuals with hypercellular obesity have an above average number of fat cells. They might have been born with them or might have developed them at certain critical times in their lives because of overeating. In hypertrophic obesity, fat cells are larger than normal. Fat cells continue to expand as they fill with more fat. When their capacity is reached, the body generates more cells. Once body fat reaches 3 to 5 times the normal amount, fat tissue is likely to have more and bigger fat cells, a condition called hyperplastic or hyperplasia obesity. Even with weight loss, the number of fat cells does not decline. Fat cells do become smaller, but beyond a certain point, they resist further shrinking, and the body strives to refill them with fat, making it difficult to maintain weight loss. Measurement of body fatness is a better indicator of health risk than body weight, and where body fat is located can be an independent risk for obesity. Individuals who have a pear shape or gynoid obesity have excess fat distributed predominantly around the hips and thighs. And this is more common in women than in men. Individuals who have an apple shape or android obesity have excess fat distributed predominantly around the abdomen or gut. And this is more common in men than women. Causes of obesity. The causes of obesity are very complex, and there is no one contributing factor. There has not been any genetic or biological changes in human biology that can explain the increasing levels of obesity. However, we live in an increasingly advanced industrialized society. Causes of obesity could be genetics, hormonal imbalance, family history, poor nutrition, food policies, eating habits, food industry, sedentary lifestyle. Excessive weight gain during pregnancy, inadequate weight loss of pregnancy weight, inadequate physical activity, inadequate sleep, labor-saving devices, excessive use of technology, built environment, and lack of recreational opportunities in some communities. The most significant factors impacting obesity today are sedentary lifestyle, unhealthy eating habits, inadequate physical activity, and the built environment. No one is immune to becoming obese. However, the highest prevalence is observed among women, minorities, those with low income, those with low education, and the disabled. Consequences of obesity. Obesity increases risk for metabolic disturbances, including insulin resistance, hypertension, hyperglycemia, hypertriglyceridemia, reduced levels of high-density lipoprotein. Together, these disorders are referred to as the metabolic syndrome. Other health conditions that accompany metabolic syndrome are gallstones, gout, polycystic ovary syndrome, chronic kidney disease, and sleep apnea. Obesity increases risk for metabolic disturbances, including type 2 diabetes, coronary heart disease, hypertension, stroke, and some cancers, and fatty liver disease. Obese individuals are highly stigmatized and face multiple forms of prejudice and discrimination because of their weight. There are also widespread negative stereotypes that overweight and obese persons are lazy, unmotivated, lacking in self-discipline, less competent, non-compliant, and sloppy. And this is a horrible stereotype or generalization. However, obese individuals make less money than their normal weight peers because of these stereotypes, generalizations, and perceptions. Stigma and weight discrimination often lead to shame, low self-esteem, and depression. Teasing, bullying, and name-calling are common both in children and adults who suffer from obesity. Preoccupation with one's weight can also lead to binge eating and extreme dieting. Treating obesity and obesity-related conditions costs billions of dollars each year. Obese individuals also miss more workdays and make more health insurance claims. Measuring body fatness and obesity. There are several ways of measuring body fatness and obesity. Clinical or field methods are used in physician offices, clinics, and research studies. They're also used by researchers in the community. Laboratory or reference methods are used by researchers in controlled laboratory environments. And these are the clinical methods that are used. Ideal body weight, weight for height tables, body mass index or BMI, waist circumference, hip circumference, waist to hip ratio, and skin fold thickness. Laboratory methods include hydrostatic or underwater weighing, ear displacement plethysmograph, dilution method, dual energy X-ray absorptiometry or DEXA, and computed tomography or magnetic resonance imaging or MRI. BMI is the most common screening tool used to indicate body fatness. It is a ratio of body weight to height, and the World Health Organization's classification of body fatness is shown on the next slide. And the slide after that shows the desirable body mass index based on age. The classifications are underweight, normal or healthy weight, overweight, obesity level 1, obesity level 2, and obesity level 3. You can see from this chart that the obesity is also recommended, excuse me. Treatment of obesity. Treatment of overweight and obesity should be long-term, similar to that for any chronic disease. Treatments require long-term lifestyle changes rather than the magic bullets and quick fixes that are promoted by many popular diets. Realistic goals must be set and readiness for change must be assessed. Combination of diet, exercise, and behavior therapy is usually the first line of defense. The combination of pharmacotherapy, diet, exercise, and behavior therapy is used if weight loss goals have not been reached in 6 months. The patients may also be recommended to try a medically supervised, very low-calorie diet. And in extreme cases, weight loss surgeries. And the surgical procedures that are often used include stomach stapling, gastric bypass, gastric ballooning, gastric bands, jaw wiring, lipectomy, liposuction. A registered dietitian nutritionist, RDN, is the best person to evaluate and recommend a realistic weight loss plan. A support group such as Overeaters Anonymous offers social support and might help the client understand other issues that affect eating. Psychological counseling can help with many underlying issues and binge eating. And medication may be prescribed to help with depression and anxiety.